All right. Good morning. PT on Ice Daily Show. My name is Cody Gingerich. I'm one of the lead faculty with our Extremity Management Division, and I'm coming to you live on a clinical Tuesday. What I want to talk about today is moving big rocks with small rocks in patient care, and also how to communicate sometimes when patients are hung up on some small rocks. And what I mean by big rocks and small rocks, right? At ICE, our big thing that we are constantly preaching is, and in our extremity division especially, is load management and dosage, and making sure that we are dosing our patients appropriately, and really making that the key player in our rehab, right? And we know that almost everything is going to improve really at the end of the day and long term with building more overall capacity of our tissues. Okay. And that only comes with some sort of resistance training, cardiovascular exercise. Those are our big rocks, including additionally to that, our nutrition that we need to pay attention to, our sleep management, our stress management, right? These are going to be our big rocks that really, when we're looking at injuries and rehabbing from injuries, the things that are going to move the needle the most and long term. Okay. Small rocks, the things that we think about as small rocks, are pretty much anything else. Okay. Manual therapy, any dry needling, cupping, massage, spinal manipulation, also things that our patients are doing on their own, right? So, in some capacity, think like any type of like braces or sleeves or like taping or a lot of these things that on the internet they're going to find, or they're going to be advised by their doctors that, like, yeah, they could wear, or potentially they just figure out that like these things make them feel better. And that's kind of where I want to lean in the most here is when we look at a lot of those things, and when we look at a lot of research, different braces and orthoses and splints and kinesio tape and things like this are not going to be strong factors in rehabbing back from an injury, right? We know that they are going to be somewhat of band-aids and things like that. And we have some research to tell us that they are really doing absolutely nothing at all to benefit our patients. But on the flip side, when our patients come to us and say, I have knee pain, and if I wear this knee brace, it helps me tremendously, right? And that happens pretty frequently. That moment is not when we bring out our research hat and we say, okay, that's cool, but what we know is it's not helping you at all, right? All of a sudden, that conversation with the patient is they just told you that something is helpful for them, and you're telling them that it's not. And so you have then lost that trust of that patient. And pretty much anything else you tell them beyond that is not going to go as well as you want it to. Justin Dunaway talks constantly about patient expectations being absolutely huge. And we talked about that the last time I was on, about patient expectations and being able to navigate different treatment styles for different people. And that goes to the same conversation here is, if somebody firmly believes that this different tool or this strap or this brace or whatever is very helpful to them, what we then as clinicians need to do is not dismiss that at all, but also move into some of those big rocks while they are still using that. So like use that small rock, which is what we are considering like a knee brace, for instance, or some people can get, if they have elbow pain, they get those straps for their elbow, right? Or even foot orthotics that help with their arch pain and knee pain and things like that with foot orthotics. Different shoes that people buy. People will go and spend money on 7 different types of shoes, where pretty much all of them could be very much the same. But the second that you make them feel like what they have done or tried is not valuable anymore, then you have decreased your own value as well. So using those things, say, great, I'm glad that you feel better with that. I'm pumped that you found something that works for you. What we also know is long term, that's what we want to do is build up the strength around that. So if we can use that brace, if it feels better while you're wearing it, when we do some of these exercises, let's go ahead and throw that on, hit these exercises. Hopefully then we can use potentially more weight, or we can do more reps with that brace on, right? And so then we are able to use their own patient expectations and move the big rocks while simultaneously using all of those small rocks that they are already figuring out. Everyone has Google, everybody has social media, everybody has all these things, and you're trying to get sold all of them all the time. I constantly get Instagram ads of all of these little gimmick things. And as PTs, we know a lot of them are gimmicks. We have that ability. Patients don't. But you never want to make someone feel stupid for getting one of those things. But if you can use that to then move those big rocks, it's going to go incredibly, incredibly well. Then as they start to feel better, we can start having that conversation of like, why don't we try these exercises without that brace today and see if that knee feels good without it, right? It's not something that you want. They're not fashionable, right? People don't want to wear them, but they feel like they need them. Okay. So then say, hey, why don't we try this? Your knee's been feeling really, really good. Why don't we then maybe not use that knee brace and see how these exercises feel without it, right? Let's start weaning them off. Very similar conversation when people wear knee sleeves when they squat and things like that. I'm never going to tell someone they don't need them, but if they don't want to use them, then they probably don't need them either. Okay. Same conversation. Foot orthotics, same thing. We have tons of small rocks that people come into the clinic with. People have told me that KT tape works wonders for them, right? I'm never going to say that I think that it is irrelevant to them. I have KT tape in my office. It's never really the thing that I'm choosing to use for them. But if someone says, hey, the last time someone KT taped my shoulder, it worked really well. Cool. Let's throw some KT tape on that, and then let's hit some external rotation, really get that posterior cuff as strong as we possibly can and use that window of opportunity that we have. Okay. The final point to that is we can similarly do some of those same things with our manual therapy. I think sometimes as physical therapists, we really love to make people believe that our dry needling is the thing that they absolutely need, right? Dry needling is going to be awesome. Cupping is going to be awesome, right? And those are the things that really get them better. And so be just aware of the conversations that you have with those tools, because the reality is those tools, although they are wonderful, are going to be still the small rocks. Okay. Using everything as a way to pull whatever pain that they have down so that the big rocks, being resistance training and mobility and things like that, can be the big rocks. And so be careful with your language as you're communicating with your patients on what dry needling is doing, what cupping is doing, what spinal manipulation is doing, right? It's not going to fix anything. It's going to really, at the end of the day, help pull pain down, give us a nice window of opportunity to bring up the big rocks, which is that resistance training, dosing appropriately, not underdosing, getting good blood flow to those muscles and bumping them forward long term. So using small rocks to move the big rocks. Don't make patients feel like they have done something dumb or potentially wasted their time, wasted their money with some of these things, especially when they say, yeah, I think it really helps. Use that. Be like, awesome. I'm glad that you found something that helps. I also think this is going to help you tremendously, and especially long term, so you don't have to use this thing for the rest of your life as a crutch. Okay. That's all I got for you today. If you are looking for an extremity course, we have missed it for 2024, but we've got some good ones coming up in 2025. We are going to be in Gretna, Louisiana on January 11th and 12th, and in Bear, Delaware on January 11th and 12th. So first of the year, get into some of those seats. I know the price is going up at the beginning of the year, towards the end of the year here. So you've got a couple weeks here to be able to jump into one of those courses kicking off the year right, 2025. Hope to see you out on the road. Thank you all.